Hello and welcome to Smart Money Simplified with your host, Brent Mekosh. Brent, you've had so many things going on in your life during this period that, we haven't seen each other as often as we usually did. How you been? How are things going?
Well, I think we're getting back on this weekly cadence where we were for a long time, and I think that like a lot of other things, today's guest is going to be very timely because obviously we had our transition to the RIA space, we bought a building, we did a bunch of other stuff, and we're settling into all that right now. And it's only been the last week or so that I've looked at my own personal life and thought, okay, you're out of triage mode now. You can get back into building a normal schedule. And for me, that means fitness. I try to
Yeah.
work out 5, 6 times a week. I try to eat healthy. Not gonna lie to you, probably in the last 4 or 5 months, I've gained about 8 or 9 pounds. I think there's been a little bit of a
A little bit
of
of
a
stress going on, a little
little bit
bit
of
of
stress. Also, not as diligent as I need to be in terms of my morning routine. And my morning routine is normally get up about 5 o'clock. I read for about a half an hour. I like to either go for a run and get to the gym. And getting back into that is really a priority for me in Q3 and 4 as we hit the tail end of the year because I've also got two young kids. And there was a time where I was doing a lot of ultra marathons, and my son, who's 9, almost 10, one of his great memories is me carrying him across the finish after an ultra way up in the
Uh,
mountains, several years ago. And I think because he saw me do some of those events, he did think I was a little bit of a Superman, and
mhm.
I'm really not right now. So I got to get back to that. So I think today's conversation is going to inspire me to do so. I have Blake Jones on, and Blake is a guy. He's got a nursing background, so a very traditional medical background. But the sense that I've gotten since I've known him is he's very much into personal responsibility. He's very much into holistic living in the sense of what's the best way we can bring our best selves to the table, both for our families, for people around us in our businesses, to our communities in general. So Blake, I'm fired up. You're here, man.
Thank you for having me. It's a pleasure to be here and a pleasure to
Why don't
get you
you
back on track.
Yeah, man. Yeah, exactly. Maybe we can make a plan for that. And
Uh-huh.
and what's give me a little bit of your background in terms of what got you here. You're also an Arizona native. I want to add that for those of us that are listening here in the Valley. And
hmm
that's to give me a little bit of your story.
Yeah, so I love that you brought up your kids and how they've influenced your perspective on health. I'll take it way back. I don't usually start this early, but when I was a kid, when I was 10, I was 150 pounds and I was a pre-diabetic. And when the doctor let me know about that, I remember having this feeling that it was really bad, but of course I didn't understand all the details and what would come with actually being a diabetic, right? And my dad was a college athlete and was always pretty thin, and I would see him do things like jump over the fence in our backyard and would always see him as Superman, right? And so it was from that point on that I really started getting involved in sports and actually having an interest from an early age in like human anatomy, physiology, performance, things of that nature. And so as I was approaching college, I decided I was going to go into medical field and thought about med school, but I'm now a fourth generation nurse. So you could say that nursing is in my blood. My mother, grandma, great grandma were all nurses in the hospital setting. So, with that being said, I felt like the hospital was where nurses were supposed to perform. So, that's where I started my career in the cardiac PCU and did a year there before the pandemic started. And then I thought I was going to save the world and start working in the ICU and influence in that manner. And at 23 years old, I had to do a lot of growing and learning in that very hectic environment. And in that same setting, I lost the care of myself and didn't feel that I had the support to get back on track, right? And you spend so much time and effort, energy, blood, sweat, and tears and taking care of other people. And that can really lead you down a very treacherous path that I saw a lot of my colleagues going down as well, which was really concerning to me, especially only at 23 years old at the time. I knew that something needed to change. And as the environment of the hospital and COVID kind of lightened up, some of the quality of the interactions and the quality of the care that we were applying to the patients wasn't returning at the speed that I was hoping to see. So I was really looking for ways that I could influence the improvement outside of the hospital setting. And so I had started personal training at the same exact time that I started being a nurse because it was something that was of interest and it was a little bit of a break from that environment. But then just within the last 6 months, I've decided to leave the hospital setting and hopefully revamp what personal training means to people and give them the full support. And so, yes, it's about exercising, but when you look at health from a holistic standpoint, everything's included, right? Your mental health, emotional health, physical health. And I like to even include financial health because to me, when you prioritize all those other pieces, it's a lot easier to make decisions that are going to benefit you financially or put your mind towards things that are going to give you a financial return, right? So, whether you're a business leader wanting to start a business or just trying to excel in your own professional environment, I know that me personally, I've always done better at all of those other things when I was taking care of myself. And that's just something that gets so overlooked. And so here I am today working with a lot of professionals, entrepreneurs, founders, CEOs, some people still in the medical field, nurses and doctors that most of them are either in the beginning phase of starting a family or they have their family kind of established like yourself. But as you mentioned, things happen. We get on these projects and our routine changes, our time commitments change, and helping people navigate that and try to maintain that personal wellness as we go through those stressful times and take on these big, lofty projects has really brought me a lot of fulfillment. And I've been able to have the opportunity to see that direct effect of how their families are and as a result to these efforts and how their business is as a result to these efforts. Whereas in the hospital setting, I'd fix people up, send them out the door, and just kind of have a dream that night that maybe everything was okay with them, but never get the follow up. So I get to have that kind of closed loop communication and really influence people more consistently and give them a lot more options because the healthcare setting, we often give people what we think would be best for them based off of data and it's standardized, which is good, but there are usually more than one option. And I like empowering people to make those decisions on their own. So, just in the past 6 months, I've really been able to do a lot of that. And here we are today and just spreading the good word. And I need to make sure that the audience knows it's Mental Health Month, it's May. And when you go on these journeys and try to complete these projects, when your mind is correct, you can think clearly and make great decisions. And sometimes we have to ask for help, and that might be professional help, and that might be a discomforting situation to get initiated. But the bravery that it takes to actually seek that help and let it come into your life will certainly give you the return a lot quicker than you would anticipate.
Absolutely. Hey, you said a lot there that really intrigued me. And one I want to go back to again when you were 10 years old.
Mhm,
What I'm guessing you did not, you're pre-diabetic, but you did
mhm,
not become diabetic.
mhm.
What were the changes back then that were made in your life that got you on more of a better track from a health standpoint?
Yeah, so I don't like to use the word luck or coincidence, but everything kind of just fell into place pretty naturally. I got the news, and that was the same year that I moved to Arizona with my family. And I started wrestling. I lost 10 pounds, hit puberty, grew 6 inches, and then it was kind of easy from there. I just segued my way into being a young athlete, right? But the eating practices were something that I really had to work on myself over years. I think up until maybe 1 or 2 years ago, I had a very unhealthy relationship with food, comfort eating, just really eating whatever I wanted. But there's a certain point in your life where you can do that and burn it off, and you don't see it physically, especially if you're
Yeah,
involved in sports. Our metabolisms and our bodies in general are very resilient and pretty efficient, right? But that tapers off over time. So the food was a really big piece for me to fix later in life, but early in life I really made a lot of change just by being active
yeah,
and trying to make my body strong. I got into doing push-ups and I would do curls with 5 pound weights when I was 12, and I wouldn't do anything really more than that, but I looked like an athlete. And that's all we think about a lot of times is looking like an athlete and then you're healthy. But there are so many other systems that need to be accounted for. I know that I would have teammates that would pass out at practice, right? Hydration, so important, especially in Arizona. So really just educating myself. But it started with the activity, which I think is where everyone should start. And then all of
Yeah.
those other pieces you can fill in over time. But when you use your body and you use your muscles, your mind is also being exercised. You make that mind to muscle connection. And I think that that is what I experienced very early on, is that mind to muscle connection and being able to really understand what my body was capable of.
Yeah, and be connected with it as well. Now,
Hmm.
fast forward to when you're in the ICU during COVID.
Hmm.
Share a little bit about what that experience was like, because you obviously made the choice to dive right into it, and a
Hmm.
lot of doc friends that I have and nursing friends as well. It was a pretty traumatic time, even if there was obviously a lot of death and there was a lot of sickness that occurred, but there was also a lot of panic across society in terms of what might come, and in many cases
Right.
that fear of what potentially could happen can be worse than what actually does happen. I do think that, not diminishing anyone that was impacted, personally or their family by COVID, because a lot of people were. But
Yeah.
when this thing first hit, what the media was telling you is that there's going to be corpses stacked up on the outside of the cities, for Pete's sake. And unfortunately, it
Hmm.
just didn't occur to that extent. But what was
Yeah.
your experience like in the ICU during that time?
Yeah, I felt like I was living in a different world, a different reality than everyone else because, like you said, the media is showing one thing. I'm experiencing something similar to what they're showing, but then you step out of the walls of the hospital, and many times it just felt like nothing was going on, right? And so that was what the general consensus was, that nothing's going on, and this is a bunch of baloney. But I had to see a lot of people die, and prior to the pandemic, I think I'd seen like 2 or 3 deaths in the hospital, and I couldn't tell you how many dozens that turned into in a very short period of time. And, um, you know, for me, it was a time of learning. I had to trust in myself a lot. And there were days where I did not want to go to work because I was afraid. There were days where I didn't want to go to work because I was anxious. Um, when I got there, it was always okay because of the team that I had. And a team approach to any challenge we have in life is the way to go. Collaboration is always going to be the answer, and leading with love and logic, I like to say, because you mentioned how fearful those times were, and we all experienced different levels of fear. Our patients were afraid, our coworkers were afraid, the general public was afraid, and people were upset with people like me who were trying to do our best with the information we had and help cure people. And um, I got attacked a couple times virtually as I was trying to create awareness around the subject. People really thought that the whole healthcare system was this big conspiracy making this disease make people sick and purposefully not curing them. And that was really difficult for me as a 23, 24-year old who cared so much about, external gratification and what people's opinions were of me. I was really putting my heart and soul into trying to save lives. And a lot of people thought that I was a bad guy because of it. And so, um, I very quickly had to realize that the self reassurance and the self gratification was what was going to get me through that. And then also just confiding in the people that I was going through it with. There was a point where I wasn't talking to anybody about how difficult that experience was. Um, we all cope with death differently. And so sometimes we would lose a patient, and shortly afterwards, people would be making jokes, and it was really unsettling for me. It was a big deal for me when the patient was lost, right? But I realized that's how they were coping with it. And sometimes there is dark humor in these public service environments with cops and firefighters, nurses, et cetera. And it's a coping mechanism, but there's still that pain inside. They still care. And when you actually have a conversation about it and you share that dialogue between people, it gives you the opportunity to not understand their perspective, but get some insight on yours. And it's very enlightening to be able to do that. And unfortunately, I didn't start doing that with my colleagues until at least a year into that situation. So I went through some dark times. Fall of 2020, was abusing alcohol at some point. I had a doctor tell us as a group that do whatever it takes to take care of yourself, even if that means you go to bed with a bottle. And a lot of us kind of took that advice because we didn't know what to do. We didn't feel supported. Therapy was available to us later down the road. Um, but some of the coping mechanisms that we adopted as a group were very unhealthy. And that's on top of a lot of unhealthy practices that we were already sharing within that space, celebrating every single day with cakes and cookies and pies, and just not having any nutritional awareness, and also not taking care of ourselves in the workplace, not drinking water, not going to the bathroom, things that are very common within nursing that we know of, but we overlook how powerful that effect is on our bodies as individuals, and also how that takes away from our abilities to provide for the patient. So again, a lot of learning. Was in a dark place mentally, but I realized I was working out consistently, and that was kind of my retreat away from the situation, but I wasn't eating well. And I can remember it like it was yesterday. The very, very lowest point I got to was around Halloween. We had all this candy, and I wasn't feeling well that night. Had to go to work the next day feeling anxious. And then so I was just comfort eating a whole bunch of candy. I don't eat candy normally, but the way that I felt that next day, it was just awful. And I got to work. I had a mental breakdown. My fellow nurses, they covered for me for my patients. I felt so bad that I wasn't mentally available for my patients because it was such an important task on keeping things afloat in the ICU setting. There's so many things that you have to monitor regularly, and medications and tests that you have to take care of. And so for me to mentally not be able to perform was very concerning for me. And I felt very guilty, but my coworkers were so understanding and supportive, and made sure that I got through the day, and made sure I got a lunch break that day, because we just got used to not having lunch breaks. We got used to not going to the bathroom and things like that. And they noticed that my care was way, way, way far away from where it needed to be. And I was always the person that was uplifting and motivational, and kind of that the crutch for the group. And I could see it on everyone's face when they saw how broken I was in that moment. And I even had someone tell me, like, no, Blake, you're the guy that's supposed to keep us uplifted. Like, you're supposed to keep us strong. And ooh, it makes me tear up a little bit. I know now what I need to do to make sure I don't get back into that place. And so that's why it's so important for me to share with other people how to take care of yourself on a daily basis, so that you're prepared for those situations, because we will face equally or worse times than COVID, right? That's just how the cycle of the world works. But if we work together, it doesn't have to cause as much destruction. It's just that when we go every day kind of taking things for granted, and then we're battle tested, and that resilience hasn't been developed, you can fall apart very easily. And I'm so grateful for the team that I had in that situation to make sure that I didn't fall apart completely, right? They were there to pick the pieces back up for me. And now that I'm not working in the hospital setting, I always want to remind people that the people within the walls of the hospital, they're angels here doing God's work, and it is very difficult. And the positivity that you see on the face of a nurse and a doctor when they walk in a room, you don't always see it, but when you see it, it needs to be so appreciated, because those people carry a lot of negative, heavy energy, and they see so much pain and struggle and death. And it's pretty difficult to go home to your family and try to act like you weren't living in that environment for 12 hours out of the day. And so the people that are able to do that for years and years, and continue to be optimistic and positive, and a shining light in everyone else's lives, they deserve the utmost support. They deserve it so much. And that's really what my mission is now, to provide for people.
I appreciate you sharing that with me, because I was definitely a person during COVID that was angry, quite frankly, at how the fear was used to manipulate people.
Hmm.
Um, Fortunately, I've got a lot of friends, and I could have been one of those people, just being very honest with you, that's angry at the healthcare establishment.
Hmm.
My wife works for Mayo Clinic, and we've got a ton of friends that are in that space. And what tempered that for me was two things. Is first, a couple really good friends that are ER docs, and they would say to me, I never stopped coming to work during COVID. they said, you don't
Hmm.
really know what we're seeing every single day. And you could see that grind them down by the fall.
Hmm.
And then also there's a remembrance, I was downtown and there were a ton of people that died in 9/11 in New York.
Hmm.
And when I would hear back then, people blaming the U.S. or it's a very different thing, but
Right.
what was happening on the island of Manhattan was very different than what it looked like in the rest of the country. And it used to just, and I was on the other side of it in that case, where it definitely generated a lot of emotion. So I really appreciate hearing your perspective on that. And to your point, the people that work in our healthcare, particularly if you're in the ICU and critical care stuff. I mean, these people are unbelievable. I've had a couple
Hmm.
for family members. I've had a couple emergency room visits that I've had to do this year, and those people have been absolutely fantastic.
Hmm.
So thank you for that. So you hit this inflection point, and when did you start thinking, all right, I love nursing. It's been meaningful for me. You've now got some battle scars to go along with your experience. That it's time to make a change, and you want to take your life and your career into a new path.
Hmm. I'd say 2022. I got in this kind of spiteful mindset. There's travel nurses coming into my hospital. They're making 3 times more money than me, and they don't have all the same expectations of me, right? And so I was like, you know what? I'm going to be a travel nurse. I'm going to go make this money. And I took a travel nursing assignment in Oklahoma where my parents live, and I very quickly realized how dangerous it is to make decisions just to make more money, right? There has to be more purpose behind it than that. And so leaving my wife was a lot more difficult than I had anticipated.
I don't
And
mean to interrupt
then,
you, but when you were in the midst of the ICU stuff, were you married at this point?
yes.
How
Oh,
that? Yeah.
I got married March 7th, 2020. So
Oh wow,
I
great timing.
I went into the ICU in April, and the world shut down like March 14th, I think, like almost exactly a week after we got married. So there was that.
So you definitely were your first year of marriage, you got thrown right into it, and you're still
Yeah,
married. So that's
yeah. Which was,
that's a victory.
it's all about perspective because I look at it, 2020 could have very easily been the worst year of my life, but I think because I got married that year, that didn't happen. And having my wife there through that experience, it's supposed to be that honeymoon phase, right? But we had to delay our honeymoon a year, and she got to see me struggling on a daily basis, and she was there to support me, and she was very understanding. And I probably wasn't always as present for her as I would have liked to be, but like I said, she was understanding and supportive through that process. And fast forward 2 years later, I'm on that travel assignment, and we find out that she's pregnant. And so that's 2 weeks into my contract. I'm like, oh, wow, this is amazing, but I'm not where I want to be. And finished out that contract, came back, actually worked a year at the Mayo Clinic, which was a fantastic hospital, fantastic team. And I have to really give a large appreciation to all the people that work there and the research that they do, because that was a very different environment from all the other hospitals that I worked at through that time period. And I talked with those nurses about their experience through COVID, and it again felt like a different world. It's like all these other hospitals are struggling, but Mayo Clinic really takes everything into consideration and looks at the big picture. And they try to be creative in the solutions that they find for people. And they were really effective throughout the pandemic, and a lot of other hospitals can't say the same. So, shout out to Mayo Clinic and your wife for being involved with them. And uh, I think that the biggest thing for me in making that transition out of the hospital setting was a feeling of guilt because of all the things that I had been involved with from 2020 to 2023, and my perspective of a nurse's role in the world, thinking that they're supposed to be in the hospital, right? But there's so many different types of nursing, so many different settings you can be in. And I really just had to swallow my pride and put my ego aside and make a decision that's going to be best for me and best for my family that I was beginning to build. So I knew that working in the hospital wasn't making me happy anymore. And I would do great things and save people and just kind of have this empty feeling at the end of the day. But my influence on people outside of the hospital always put a smile on my face and made me feel very fulfilled. And we talk about ikigai and the Epic Fit Network very frequently, or Dharma, your purpose in life. And my purpose is to educate and to heal and to motivate and to empower. And I was able to educate and heal within the hospital setting, but it was hard for me personally to continue to motivate and empower. And a lot of that was because of some of the standardization of what we tell people to do with themselves. And there's clearly a lack there in how we educate, because most people that get hospitalized don't get hospitalized once, and they're not given the support and the solutions and the resources to stay out of the hospital, which I think should be the priority. But a lot of times we just expect to see them again eventually. And every time you land in the hospital, it's literally taking time off of your life. And it is so hard to recover from being in the ICU for multiple days. And a lot of people that are in that situation, it's a result of decisions that they made. So that means that it's able to be avoided, right? But they either don't have the willpower to make the right decisions, or don't have the understanding and awareness to make the right decisions, or don't have the support. And um, that's what I'm really looking to change for not only the patients, but also the healthcare workers. I had a lot of healthcare workers, colleagues that I had to take care of, that had very bad outcomes from COVID because of the practices that they were allowing in their life on a daily basis while working in the healthcare system. And your, I guess, skepticism towards the healthcare system is certainly warranted. I want people to understand that the healthcare system is its own thing, and then there's people within that system. And so
Right.
the nurses, doctors, all of that, those staff members, they're working within the system. They're not part of the system. They're not making those decisions that are affecting everyone. They're making decisions that affect individual patients, right? And so that was what was difficult, because at some points we felt like we were being misled, and we felt confused because there would be updates on a daily basis. Like, you can wear a mask here. You don't have to wear a mask. This is the kind of mask you have to wear. This is how far you have to be. Things were changing so consistently that we questioned the accuracy of what we were being told to do. And then we saw patient outcomes that were very frustrating, and we did everything we could. So we questioned the therapies that we were implementing. And question is the right thing to do. We should always question things that we're uncertain about. And sometimes we weren't able to get the answers that we needed, and sometimes we were. But the anger and fear comes from misunderstanding. And so that's why it's so important for us to do research collectively and individually, collaborate on what we find, and have discussions about things. But a lot of the public wasn't able to have discussions. They were just being fed information, and they weren't
And
an
told that
active
was gospel,
player.
and they, yeah, exactly.
Yeah, yeah. So that's what really caused the uproar in the entire world, because there's literally two different realities being experienced, right? But
Yeah.
me personally, it was a roller coaster of emotions, and I'm glad that I ended up on top without needing to be medicated, without needing significant therapy. I probably could have benefited from therapy, but there's so many
We
different
all
routes you can
we all
take, and
probably can.
I'm just blessed to be here with you today, and in a good spirit, and not permanently damaged from that
Well,
situation.
well, let's look forward, because I do think, all that stuff, it hardens the steel, and so now you've got this vision for what you want to do to be helping people to stay out of the hospital, stay out of the ICU. So give me detail in terms of what you're doing now, who you're working with, what kind of services you're providing, and what the vision for you in the next 5 and 10 years is.
Yeah, great question. So with Elevate Personal Training LLC, I have recently been transitioning to more of, I could say more of, only online, because I want to be able to service more people. And in the past, I didn't see the value of an online coaching style, and using these new technologies that we have, and being able to organize things properly and follow up with people. I see now that not only can I provide significant value to people, but I can provide more value than I would if we needed to meet in person on a regular basis. So I've been able to, like I said, work with some founders, CEOs, some doctors, because doctors need that guidance as well. doctors don't really receive much nutritional training in medical school. That is not a priority. Pharmacology is very heavy. And I personally try to avoid medications as much as I can. And a lot of my colleagues feel the same way. But when we're in the hospital setting, that's really all we do. We fix everything with a medication, and we send people home with medications, and we don't really give them solutions otherwise. So I'm able to help doctors navigate those things for themselves, which they end up implementing in their practice and for their patients, and kind of change their perspective on certain things and what people need. And also entrepreneurs, people like yourself that have a little bit of flexibility in their schedule, and they can actually have a morning routine because they don't have to go to a job at 6 a.m. and be there for 10, 12 hours out of a day. Those people need to understand what a blessing that is, and how much power they have, and how they can really optimize their performance, right? And when you develop that routine that doesn't have to be so crazy, because people do sauna and cold tub, and yeah, you can do all of that, but health is on a spectrum. And so what I'm able to do now with my clients is decide where on that spectrum they want to fall and develop a plan for them. And we go through their exercise routine, their nutrition program, the supplements that they might want to explore, and then also make sure that they're doing the basic things like their checkups with their doctors, and getting sunlight, and just kind of checking the boxes on a regular basis. And we follow up with each other. They let me know if they're traveling, and we can make adjustments so that they don't fall off while they're traveling, or they don't fall off when there's a big project that they're trying to accomplish. And that's been good for me, because like I was telling you off camera, is that I see the family effect. So I'm targeting these leaders, right? And they have this trickle down effect, and their family ends up wanting to be more active and healthy, or their spouse sees the change in them, and either their spouse is already in a good place and they're just proud that they're kind of catching up to them, or their spouse needs to do work on themselves. And a lot of time I end up helping them as well. And of course, we talked about our kids needing to see that example. So the kids very often follow suit of what the parents do and how they live. And I'm also able to have those discussions regarding their business and see how their professional performance has improved with their physical and mental performance. So I right now have a cap of 24 clients that I want to work with, and want to eventually get them into an online community so that they can help support each other as well. Um, because, like I said, a team is very powerful, and collaboration is very powerful. Vulnerability is very powerful. So when people are able to have discussions with each other about their struggles, and then also give each other options and solutions, and help each other outside of that health sphere as well, a lot of magic happens. So I'm looking forward to that. The infrastructure for the online community is being built out right now, and I'm kind of making my roster of people that I want to be included within the group, because it needs to be uh, pretty strategically chosen. You don't want a bad apple when people are trying to cross interact with each other in a setting where personal development is the priority. So that has been my most recent endeavor.
So, in terms of somebody that engages with you, what does that look like? So, let's say that you've got a founder out there, an entrepreneur, or a person that is doing whatever they're doing in life, but they're looking and saying, "Okay, you know what? I'm all right. I'm not in the ICU yet, but want to increase that performance in all areas of my life." And they say, "Okay," they listen to this and say, "Blake Jones, this could be my guy." What happens?
Mhm. Yeah, so right now, my program is pretty standard at $10,000, and what people are getting is access to a nurse to collaborate with and to reference to. A lot of people will go to the ER because their stomach hurts, but there's a lot of solutions we can explore before you get that extra medical bill, and also take so much of your time away to go sit in a room for 2 hours to be seen for 15 minutes, right? So my clients are locked in for a year. And that's something that's new, because I have found that when people commit for a month, they get started, they get the ball rolling, and then life gets in the way. That's expected. But I want people to anticipate and understand that we can make maneuvers. We can call audibles when things happen, because we know things are going to happen. So this is an adaptive program that's going to grow with the individual over 365 days. And like I said, they're starting off with their overall health plan, exercise, diet, supplements, but sometimes that diet needs to change. And if you haven't done a food sensitivity panel or something like that, then that might be something we need to add and then make adjustments along the way. And at the end of a year, you're able to really have that routine ingrained. And so things become second nature, but you always have me as a resource and a reference point along the way. Whether you fall off a little bit and you need some more accountability, we make that happen. If you are not liking the results that you're getting, we explore why. I have a client, for instance, that went and saw his doctor. They're talking about his testosterone levels, right? And we're going through all these things. I don't know why my test is low and my cortisol is low. And he smoked cigarettes. I said, did the doctor talk to you about the cigarettes? So I was able to do research for him, just very simply presented to him that if you smoke cigarettes, these are all the things that could change. And these are all the things you're complaining about. And sometimes it's that simple. But again, we have medications, we have hormone replacement therapy, we have all of these bells and whistles and shiny things that can put a band aid over an issue and make us feel good temporarily. But eventually we'll have to keep adding more things onto it rather than I help people understand that your body is where everything starts. Your mind is where everything starts. So these individuals are empowered personally and then always, always able to explore their options rather than just say yes to one option that's presented to them.
I'm going to put you on the spot right now, Blake, if you don't mind. All right.
Mm-hmm.
Before we wrap this up. So I'm 50 years old right now. I
Mm-hmm.
will say that among a lot of 50-year-old plus guys, the use of two things, peptides and
Mm-hmm.
TRT, is massive. It's
Yeah,
absolutely massive.
certainly.
Um, Among women, you start to get above 40 years old, Ozempic.
Mm.
The uptake in terms of the amount of people using that is unbelievable.
I wouldn't
Uh,
even,
um,
yeah, just say women. We're trying to make kids start taking that stuff.
Tell me what you think about all three of those things I threw out there: Ozempic, TRT, peptides.
Okay, so I'll go in that order. So Ozempic first. Oop, messed up my camera. Ozempic is a fantastic peptide. It is a peptide as well.
It is okay.
Um, it is good for people that cannot lose weight or cannot get their blood sugar under control. Now, that is a very small percentage of the population, right? And it's easy to get prescriptions for anything in America. All you have to do is check the right boxes or make the right complaints, right? So if somebody goes to a doctor and says, I've tried everything, which is what most of us say when something's wrong and we don't want to take accountability for the decisions that we've been making. I
Sure.
don't mean to call anyone out, but Ozempic is a glorified appetite suppressant, right? And so it's not teaching people good practices. And that's where I come in. I teach people good practices. You can lose weight. You have to eat the right foods and eat the right amount of foods. And you have to exercise at the right intensity and the right frequency. And some people, it takes a lot longer for them to see results. And we all want that cookie cutter answer.
No, we won it
Ozempic ends
today.
up
We
being
won
the
it yesterday,
cookie
Blake.
cutter
Come on.
answer. Right, right, right.
Yeah.
Ozempic's a cookie cutter answer because you know you're going to lose weight. If you take it,
Right.
you will lose weight 100%. If I give you a workout and a diet plan, you might not lose weight. And that's because you might not follow the plan, right?
Right.
So, Ozempic has its place and it is very effective, but what people need to realize is that you are more than likely going to lose muscle mass along with that fat mass. And the overall weight that you lose can be anywhere from 20 to 40% muscle. And everything that I do is about preserving muscle mass because that's what's going to help you live a long time.
And that's what, and I wonder then, you hear that stat, is then what does that mean for your heart? Your heart is muscle.
Hmm.
Like what are the repercussions of that?
Yeah, that's a
Um,
good question.
because
Um,
your heart's a big muscle, and
mhm.
I read something about that muscle loss with Ozempic as well. And real quickly, TRT and other peptides. What do you think?
Yeah. So I just wanted to
Not
touch real
fair of me,
quick.
by the way, to ask to ask you
No,
like
it is fair. I
advice on
love it.
specific medications,
I
but
love it. Now, your heart muscle is different than skeletal muscle. So I'll just say that, we might find out down the road that it has an effect, but most of that loss is going to be skeletal muscle, which
got it.
is equally important in my opinion, though. Now, TRT, we need hormone balance, right? So if dudes are out of this therapeutic range, I think below 250, then yes, you probably need TRT if you are making the right lifestyle choices. You're not smoking cigarettes, you're eating well, you're working out, and dang, my testosterone is still in the toilet. A lot of people want to optimize their TRT or their testosterone levels, which is okay, but there are a lot of natural ways that we should be trying to do that before we inject ourselves with an exogenous hormone. And that range is very wide with testosterone. So another piece of that needs to factor into how the individual feels, because you might feel a lot better at a 450 testosterone than I do. And we don't all need to be at 1,000. And that's what a lot of people are kind of striving for right now, because yes, you look good and your muscles will, be a lot bigger and firmer, and you're gonna have energy and libido. But there are consequences with artificially increasing your testosterone, especially like I said, if you're not making those other health practices along with it. So hormone replacement, very important. A significant innovation that we've had in the healthcare space. And I think that people just need to take it with a grain of salt and make sure that they're ready to do that for the rest of their life if they're going to
They're gonna do that.
engage with that. Right.
Yeah. Well,
And then the other one was peptides.
yeah. I mean, which is, I know
Yeah.
it's a broad. That's a category. You could probably do a whole
Yeah.
show with that.
Yeah, peptides is super broad. I like peptides. More research needs to be done. It's not one of the things that has a whole lot of funding behind the research, and there's been controversy behind it. Some of those products have been taken off of the shelf just within the last 4 months, so that they can have research done and be FDA approved, and this, that, and the third. But I can think of at least 12 different peptides off of the top of my head. There's ones for weight loss, one for muscle building. There's peptides to make your skin more tan. There's peptides for just cognitive function. And so, again, when you get into this kind of vanity piece of health, and the aesthetic, I guess is the nicer word to say, where you just want to look good, there are often more side effects and consequences associated than people anticipate. And so I always just remind people to take the risks and benefits into consideration before they make a decision, and do your research, because this is a newer option that has not been heavily researched, but there are significant benefits. And growth hormone secretagogues in a peptide form are a lot safer than just taking straight growth hormone, for instance. So it's like, if you're considering a growth hormone and you have these symptoms or whatever you're trying to accomplish, peptides oftentimes will be the safer option for you at least to attempt. But again, there will be a lot of things that we discover over the next few years in regards to the long-term effects of these.
No question. Well, Blake, man, this was fantastic. How do people find you? How do they get a hold of you?
You can go to elevatehealth.coach, my website, or you can send me a email to Blake at Elevate Health. Oops, I think I'm getting a phone call there. And that's on my camera. Okay, let me re-say that.
No worries.
You can go to Blake at elevatehealth.coach. That's my website. There's a questionnaire on there, contact information, or you can send me an email, Blake at elevatehealth.coach. And I'm also on LinkedIn, Blake Jones, RN, BSN. And I have Instagram, elevate.levels is my Elevate personal trainings page. And then I have a personal page as well if you want to follow me on there. Blame it on _Blake Instagram. So I would love for people to reach out to me just for conversation. I like being able to collect data and kind of have a better understanding of what people need. And yeah, if you are an entrepreneur, CEO, founder, I think that there's always room for improvement in that routine that we talked about and your overall wellness. And it'll certainly give you benefit in your personal and professional endeavors.
Awesome. Blake, thank you so much, man. This was great.
Yeah, no problem. My pleasure, fellas. It's been a great conversation and a great way to start the day.
It has been. Blake, I have to say, you always have really interesting guests. I find myself paying a lot of attention to the folks you have on your podcast. I just want to add an underscore a note that he made. The example that parents make and the example that leaders make is profound. And I was very fortunate that I had a dad who back in the 1950s came out of the Navy and was running a mile a day and doing his own free weights routine. And I had friends of mine going, "What is wrong with your dad?" They were all like, "What's wrong with your dad?" And
Mhm.
I have to tell you, it carried through to me. It carried through to my son, and it's carried through to my children and
Mhm.
my daughter and my grandsons. It's powerful, Blake. What you're doing is
Yeah.
powerful, and I just want to let people know that's the most important thing that you've
Thank
talked
you.
about today. You
Yeah.
know, Brent, like I said, I enjoy these conversations. I feel like I, could listen to them for much longer than they actually end up being. But I know we've got to wrap this up. So before we go, if people are listening to this conversation, we now know how to get hold of Blake. How do they reach out to you?
Yeah, you can call us at 602 active on LinkedIn as well. Smartmoneysimplified.com or tws.finance are two websites as well that have all our contact information. And we'd love to have a conversation about anything you talked about today and just get to know some people a little bit better.
Yeah, it's great. I would encourage folks who are listening to, in fact, if they haven't spoken with you, start a conversation with you. I'd also encourage the people who are listening today who are not subscribers to become a subscriber to the podcast, which is really easy to do. You just hit follow. Bam. Then every time Brent drops a new episode of his podcast, you're notified and you can listen to it. I would also ask that if you like it, keep it to yourself. Tell other people about it. Share it. Word of mouth is a great promotional tool, and we would really appreciate it. On behalf of Brent, I'm Bill Tucker and everybody at the Wealth Stewards. Thank you so much for taking the time to listen today. And I must remind you that today you have a choice. You can go out and make today a great day or not. It's your choice. Thanks for listening. Until next time.